Welcome back, everyone, and welcome back, Margaret. Thank you so much for joining on the call today.
Oh, I'm thrilled to be here, Deb, as always.
Margaret, you and I have been working together for so long, over 15 years, and
Yes.
you are one of the biggest, most important people in my village. So thank you for always being here and at our beck and call when we need help with our clients and our little babies that we're working with.
It's
You
a
are
privilege.
for sure. You're a wealth of knowledge, and we're going to share your website and information about you in our show notes so people can go and research more about you and all the things you offer. But you're also a mom of two children, not children anymore. I guess they're older now.
They'll always be my babies, but yes, 25 and 19. Yeah.
But I think that's, the beautiful thing about the village that we've created here is that we do a lot of the work that we do because of our own personal experiences.
Absolutely.
And I know that you've had a lot of these experiences in your own life. So as an RMT and so many other different certifications that you've got and experience, there's some really important messages that you can give here to parents. And I don't think that we look at our alternative therapies as ways of healing and supporting us. So being an RMT, there's so many things that you can help specifically in the postpartum period with new moms.
Absolutely.
Yeah. So today's hot topic is actually things you didn't know that you might want to know. And really it's with how massage or how dealing with things like scars from maybe a breast surgery or a C-section might actually be impacted postpartum and what can be done about them. So tell us some of the problems, the common complaints you've heard about these sort of things after birth.
Yeah. I think we pay so much attention when we're pregnant and the excitement in our changing body. And one of the things from my 30-year career is, and that what touch has taught me, and Deb, I was telling somebody the other day, I've treated over 40,000 patients during my career. And I've been at the birth of over 100 babies, and I've lost count of how many pregnant women and postpartum women. Our bodies are all connected. Mind and body are connected. And what the interconnection between things sometimes is often lost. So we don't think about things that we've done in our past or things that have happened to us and how that can impact our bodies and therefore how it can impact our health and our outcomes. There's also the whole idea of the emotional manifestation. Stress is basically our bodies are a house for our emotions. So emotional or physical manifestation of emotional pain is there as well. And when you go through pregnancy and labor or perhaps you've had surgeries in the past, our body shows that. And we don't often think about the impact that can have in the postpartum phase. And I see this on a regular basis because the body's connected. So we can't just, you've got back pain, we just better treat the back. That's not the way the body works. Everything's interconnected. The nervous system has an impact, the circulatory system, the vascular system, the lymphatic system, it's all interconnected. So some of the things you may not realize, and this has just happened recently in my clinic, C-section scars, for example. You've had a C-section, maybe it's new, or maybe it's 40 years old, like the woman I just treated a month ago that a doctor referred to me, could be having an impact, and this has been shown in research, on chronic low back and shoulder pain years to come, years later. Here's a perfect example. And sometimes it's right away in the early days of recovery and postpartum, but it doesn't always have to be. And over time, it starts to show up because of the fascial system, the connective tissue from the tip of our head to the tips of our toes. And now we've cut through our abdomen, which is cutting through nerves and vessels. I had a patient referred to me by a doctor, 74-year-old woman, and she had frozen shoulder, adhesive capsulitis. She could only lift her arm to here. She'd been to all kinds of therapists for months. And this doctor who knew me decided to refer her to me. Go see Margaret for massage and microcurrent point stimulation therapy, which is a Health Canada approved technique and device that I'm trained in, but what's even cooler, that can be used at home. It's Health Canada approved to be used at home. She came to me, and one of the first questions I asked her, because she was having shoulder pain, is, did she have children? She's looking at me, Deb, like I was crazy because she's 74. And she said, yes, I've had 2 babies. And I said, and by any chance, did you have a C-section? She said, yeah, 2. Do you know that I took out my microcurrent machine And I did a scar release on her C-section, which was 40 plus years old. And before I even touched her shoulder, I hadn't massaged her shoulder yet, I asked her to sit on the side of the bed, take 3 deep breaths in through her mouth, out through her nose to help reset the nervous system. And then I asked her to try to lift her arm. And honest to goodness, Debbie, my jaw dropped because her arm went from here to here like that. We
Amazing.
released a scar, and that fascial pathway and that connection through the meridians changed the game. She screamed out loud. Her husband was in the waiting room. This was before COVID. And he said, "Are you okay in there?" And I brought him in and said, "Show him what you can do." And she was amazed. You know, the doctor called me and said, "Margaret, I cannot believe you made me look good." They called her in the parking lot when they left my clinic. So if you, and preventatively, if you've had a C-section, it's not to say that you are going to have back pain or shoulder pain, but do know that there are things you can be doing to prevent that from happening. You can see therapists like me to have massage and microcurrent so you can prevent issues from happening. We don't want to wait till something's broken.
No, you're right. And I'm a testament to this too, Margaret, because if you remember a few years back, we were doing a baby show together, and I actually came in on one of the days with really severe lower back pain. And you said, "Did you have a C-section?" And I said, "Yes." And you made me open up my shirt right there and then and lower my pants. And you did the treatment on me right there. And it felt a ton better. I wasn't 100%, but I could actually move. I could endure the rest of the day without feeling
100%.
that pain. So
This is based in
anything we can do.
science. Yes, this is needless acupuncture and microcurrent combined. And then you add massage on top of that. It's a game changer. It can make a huge difference. Same with women that have had breast reduction surgery, perhaps. Or I've even had a woman that's had a mastectomy and postpartum really struggled and with scar, having pain, inability to move her arm, swelling. Working that scar through massage, through hydrotherapy, through microcurrent point stimulation. Notice what I'm doing is layering on evidence-informed treatments that can make a difference together. There's not always just one magic pill or one magic fix. Sometimes it does work just like it did on that woman. Other times we have to layer things in. But what you should know is that you have options to consider, that you don't have to just suffer in pain, or that you just have to pop a pill for and think that that's your life forever, because it doesn't need to be that way. Touch is incredibly powerful. And sometimes we don't even know what we're storing and how we're storing it in our body because we don't pay attention. We're new moms, we're busy, we're focused on the baby, and we're not taking care of us. Taking time to have a proper, good therapeutic massage, not only is it going to be good to drop your cortisol, your stress hormone, but it's also going to be really important to show you where you are holding stress in your body, teach you what is happening in your system. Because if you want to be the best mommy to that little, you better lead by example and take care of you, because your child's going to be watching in years to come.
That's right. Well, and you hit a hot topic button too, because a lot of times parents don't realize, whether it's, the new mom or even the dad, whatever they're going through, they don't realize that the pill is not the fix. The pill is the cover. So if they are popping a pill and it's making them feel better, it's not necessarily treating the problem. And I love that that's what you focus on, is yes, definitely take the pill, but let's treat the problem so that you don't have to
get to
take
the
that pill
source
forever.
Yeah,
right?
let's get to the source of the problem if we can. I'm a big proponent of integrative collaborative medicine. I don't believe it's alternative. It's not me versus a medical doctor. No, we're better together as one. And that patient should be right in the center of that care. And most importantly, the most important person on that healthcare team is the patient, is the person, because they should be playing an active role in their health. But our system's not set up that way, Deb. Our system is really a sick care system. Wait till it's broken. I like to refer to what I do as taking advantage of the opportunity gap. And I explain this because we have an amazing system, certainly here in Canada, that if you're sick or you need a surgery, you need acute care. We're very fortunate we have that. But we don't invest in preventative medicine. We don't invest in teaching people how to help themselves, how to reduce their own stress, reduce their own anxiety, improve their own immune system. We wait till it's broken. What I love to do, and this is why I also love working with babies and pregnant mamas, is because I want to have this opportunity gap. You're healthy or you're sick, but in here, there's limbo. And I hear so often moms will say, Oh, my doctor says I'm fine, but I don't feel fine. And they're waiting until they can get a diagnosis before they try to fix themselves, before they
Right.
take that pill or have that major intervention. Well, what if you stock your toolbox with evidence informed strategies that help to keep you on the healthy side of things so we don't need to be over here?
Yeah. No,
So
you're
you can
right.
live
And
well,
you're
right?
right. And when it comes to massage specifically, and this is why
Yeah.
I love having you talk about it, because first off, there is so much more that you do than massage. The massage
Yes.
is just a piece of it. There's so many other things that you can do to help as well. But I think that historically it's looked at as a luxury. So if a new
Yes.
mom were to go out and get a massage, people would be thinking, oh, must be nice. When really that's not a luxury. That mom, she's been, she's getting neck pain from looking down all the time, feeding. Her wrists are killing her because she's been now holding the baby in a certain way. Her back's hurting because she's sitting up, sleeping, carrying more weight. So there's so many things. So it is not a luxury. And I think it's important for all our listeners and viewers to really know that this is a necessity.
Oh my
So
gosh, Debbie, thank you for raising that. You're 100% right. And I am an advocate for all people and even with government to change the way we look at healthcare. Because, like you said, a luxury, no, it's an essential. And we know that if we can, even from a fiscal perspective, waiting till things are broken, it costs a lot more to put people back together than it does to prevent illness. But what about the vitality and living well? And you're right, nursing shoulders, neck pain, headaches, fluid shift, an inflammatory response, feeling stressed, having exhaustion, your cortisol levels are all out of whack. These are all things that massage can address and has been shown in research to help. And so in order to be the best mom and partner and society member you can be, taking care of yourself is critical. And then you can take better care of your family. And so we have to change our mindset. And I've been on this 30-year mission and will continue to be advocating to change the mindset of Canadians because we've been taught to have a pill for an ill, wait till it's broken, and to look at things as it being a nice to have instead of it is a must have. So thanks
that's
for
right.
bringing that up because that's my wheelhouse of passion and where I could go on for days talking about it
Well, and
for sure.
this is where they say, when you're on an airplane, you have to put your mask on or you won't be able to
Yep.
help anybody else. So if we're not practicing that self-care, and that's where it's important, it's self-care, not self-luxury or self-pampering, it's self-care, then it's going to be more devastating than if you were just proactive about it. So I think that's really important because sometimes, in often cases when someone's had a baby, if they were fortunate to not have any tearing or didn't have a C-section and didn't have any scars in the past, they may not need or see a benefit for massage. But if anyone is suffering from scars, C-section scar, breast surgery scars, like you mentioned, even if they've had cancer and a mastectomy, these are all things to really be wary of, that A doesn't equal A. That's something I learned. You might have a pain happening here that's
Yep.
actually extending from down here at the C-section. So for any of those parents out there who are struggling, reach out to Margaret, reach out, to your local, if you're not within a local area, or book a telemedicine call with Margaret, because she is so informative on this, and the information and the stocking of your toolbox is crucial. So Margaret, thank you so much for sharing all this
Uh,
information.
Thanks for having me, Deb. You know how passionate I am to help empower and educate people to play an active role in their health. And even if you don't have anything postpartum, you not only deserve to have massage therapy, it is critical so that you can uh, lay a foundation for health to come and to lead by example. Your children are watching. And I think you don't realize really, we exemplify, our kids are watching what we eat, if we move, how stressed we are. You're going to be a better mama and you're going to certainly show your children how to live well with vitality and for a long time if you show them how to do it. Lead by example.
I love that. That's a great message for our parents to take away. Well, thank you so much, Margaret. I'm going to have all the information in the show notes so people can reach out to you directly. Thank you,
Thank you.
everyone, for coming in. And Margaret, thank you so much for being here today.
Always a pleasure.